Good afternoon, and thank you for joining us today for Connect and Share, our monthly lunchtime webinar series. My name is Lisa Assemacher, and I am the Communications and Training Specialist here at CEDM. For those of you unfamiliar with CEDM, we are a nonprofit trade association supporting community-based economic development. Members across Michigan have programs related to affordable housing, financial empowerment, access to transportation, food, and more. CEDM supports this work through policy advocacy. We host an AmeriCorps program supporting foreclosure prevention. We provide up-to-date, synthesized information and resources related to best practices, funding, and peer stories, as well as significant discounts to different trainings and other educational resource development like toolkits and webinars. One such benefit is free access to all the monthly webinars hosted in the Connect and Share Lunchtime Webinar Series, which is where we are today. These webinars vary in topic each month, but all are focused around community-based economic development. In general, non-members pay a small fee to participate, but we occasionally make them available to the public. If you're ever interested in learning more about membership, please visit cedm.info/membership or contact me, and I'll happily answer any questions. Without further ado, I am pleased to introduce today's topic and speakers. We're here today to learn about two different public programs that are available in Michigan and learn how to navigate them best to serve your clients. First, Tara Truax is the Housing Program Specialist in the Housing and Homeless Services Division for the Population Health and Community Services Administration of the Michigan Department of Health and Human Services, and she will be describing SOAR. And we also have Beth St. John. She's with the Michigan Benefits Access Outreach Program, which exists to increase economic stability for Michigan families by connecting them to multiple public benefits through the MI Bridges website and community partners. Welcome, Tara.
Thanks, Lisa. Good morning, everyone. My name is Tara Truax. As Lisa mentioned, I'm the SOAR State Team Lead, and I do work for the Michigan Department of Health and Human Services here at the state of Michigan. And I'm here to just kind of give a brief overview of SOAR for everybody on the call today. I actually see some familiar names in the participant list, and I think we might even have some people who are SOAR trained who are actually on the call today, so this will be a review for those folks. But I'm going to do an overview of SOAR. I'll tell you guys about what SOAR is in Michigan, because each state has kind of a specific type of process that we have for SOAR, and SOAR is active in all 50 states. And then we'll talk about how you can become SOAR trained and integrate SOAR into your own practice if that's something that is a goal of yours. So what does SOAR stand for? SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. And what SOAR is it's a program that focuses on people who are experiencing homelessness or who are at imminent risk for homelessness and who are experiencing a disability. The program is sponsored by the Substance Abuse and Mental Health Services Administration, better known as SAMHSA, and we've been collaborating, or they have been collaborating with Social Security Administration since 2005 to create the SOAR program. As I mentioned, it is active in all 50 states. One of the challenges of SOAR, at least for us here in the state of Michigan, is that there is no direct funding that's provided to states for SOAR. That is something that we are working with our technical assistance folks at the national level to try to address at all times, but as of right now there is no funding, at least not directly for SOAR. But we do fund it through we fund some of our SOAR activity here in the state of Michigan through our Projects for Assistance in Transition from Homelessness programs, what we call PATH for short, and that's a street outreach program that's active in many communities across the state that focuses on outreach to people who are experiencing mental illness and who are also experiencing homelessness. So each state and many localities have multidisciplinary committees that meet periodically to oversee SOAR implementation at the state and local levels. We do have several SOAR stakeholders meetings that happen across the state here in Michigan at different times throughout the year. And one of the greatest things about SOAR, in my opinion, is that no applicant is ever charged a fee for SOAR assistance. So when people are doing SOAR with clients in the community, they're being paid, of course, by their employer to do the work that they do, but they never charge the client directly for any of the assistance that they get. So that kind of sets us apart from, the work that lawyers do, for instance. So in order to kind of sell SOAR, I often will point out what kind of sets SOAR apart from just kind of doing a regular application at Social Security, going down to the Social Security office or making that phone call or even going online to do the application. One of the other great things about SOAR is that it allows people who wouldn't otherwise be able to complete an application without assistance, like a person who's experiencing a disability and who's also simultaneously experiencing homelessness. It's particularly true, of course, for people who are chronically homeless or who are even folks who are just, homeless. We use the word chronically homeless. It's a bit of a different definition that I won't get into, but certainly it's difficult for people who are homeless to keep up with appointments and make sure that they do everything that needs to be done to get an application as complex as a Social Security application completed and everything like that. So without assistance, we do know that many people who are eligible may never receive the entitlement that they might be eligible for, like SSI or SSDI. But with SOAR, we see that incomplete applications or those that end up being denied for technical reasons are greatly reduced. Disability examiners are able to make more accurate decisions because they get all the information from the SOAR practitioner who's there to provide all that information on behalf of the customer. And communities benefit from addressing homelessness in a more effective and systemic way. There's income that comes, of course, along with benefits. That's the whole point of getting benefits, is to get income, and it has an impact in the community and at the individual level. So people with disabilities experiencing homelessness are able to take their first steps away from homelessness and toward actual recovery, because we do know that, when a person can't get housing, can't work, and is experiencing homelessness, there really isn't any good solid recovery that can happen with that individual, unfortunately, until they're able to kind of stabilize their lives, and income is a huge part of that.
Tara?
Yes.
Is the program called SOAR in every state, or is it the same program?
It is called SOAR in every state. SOAR is a nationwide program. Like I said at the beginning there, it's funded or supported. I guess funded is a bit of a misnomer, but it is supported by the SOAR or by Substance Abuse and Mental Health Services Administration, SAMHSA, at the federal level, and it is called the same thing across the entire nation. So I'd like to illustrate here that, as I kind of got to in the previous slide, SOAR does have very broad goals. Obviously, one of the first things that SOAR creates an opportunity for an individual to receive housing or to obtain their own housing. So once they get the benefits in place, they're often eligible for subsidized housing if they get, if they've got a disability designation and they're receiving Social Security income. Oftentimes they can get into certain subsidized housing situations. Certainly they can, rent their own apartment or even pay their mortgage if they have a home of their own, and maybe we're in a bit of a crisis with being able to pay for their housing. It also allows folks to access treatment and access a higher level of treatment and other services in the community. As most of you probably already know, when a person starts receiving SSI, they automatically are eligible for Medicaid. And Healthy Michigan Plan, although it is a benefit that is afforded to people who would otherwise maybe not be able to, receive health services, Medicaid is much more enhanced than Healthy Michigan Plan is. So it also allows people to have employment opportunities, quite frankly, and we don't always think about this aspect when we think about people who are receiving benefits, but people who receive benefits can work, and they do work. Just because you have a disability or receiving benefits doesn't preclude you from being able to work. So once people are able to get income and get housing, sometimes they get back on their feet and they do start working, even if it is just a part-time job, and that's always something that's encouraged as well. And community investment, people are able to be community, and have a home and a life there in the community. And we also, of course, find that it decreases incarcerations and hospitalizations. Once people are able to get more stable and get access to treatment and care, they're not out on the streets, hopefully, as much, and it's allowing them to, make better choices for themselves and hopefully, have a higher level of wellness. So a couple of myth-busting things I wanted to kind of point out about SOAR, what it is, what it isn't. SOAR isn't about making everybody who is homeless eligible for SSI and SSDI. There is a screening process. Certainly people who are trained to do SOAR applications are not out there just attempting to assist every single person experiencing homelessness with an application for Social Security, because quite frankly not everyone is eligible. So that's part of the process of learning to do SOAR, that we learn how to kind of assess the individuals that we're serving in a really more strategic way, so that we can make sure that we're not assisting people that may not qualify, but that we are getting to those people that may have a little bit tougher case, but with our advocacy as SOAR representatives might be assisted. It is about helping people who we believe are eligible for SSI and SSDI, and we attempt to get an approval on the first application. One of the things with Social Security applications that you often hear, especially kind of out there on the beat from clients in the community, is, oh, you never get approved on your first application. And that is simply not true. Many of the people who have been doing SOAR applications, myself included in the past, have found great success with clients on assisting them with applications and having them approved on the first application. It does take a lot of work, and it is a skill that you develop over time, but when it works, the payoff is great, and it really is a great feeling for that client as well as for the person working with them. And it's key to ending homelessness for people with disabilities. People who have a disability that's a qualifying disability and who are homeless should be getting what they are entitled to, quite frankly, and SOAR assists people in getting access to that. So it doesn't end when the determination is received either. So the cool thing about case managers working with people is that, they work with people over the long term a lot of times. So, for instance, if you're working at a community mental health agency and you work with one of those people to, do a SOAR application with them and get them assistance through Social Security benefits, that work continues on after that person receives benefits. So that case manager is able to kind of follow that person through and say, hey, let's look for housing now, or let's work on getting employment. So it creates that longevity to working with an individual and seeing them through to their recovery. And it's about making housing and treatment possible for people and helping people recover. So there's a lot of different, agencies and entities that are involved in the SOAR process. I listed a whole bunch of them here. I'm sure that there are others that I didn't think of that I didn't put here. A couple of the agencies that I wanted to point out here, up here in the upper left-hand corner, SSA, of course, is the Social Security Administration. After that is DDS, which is Disability Determination Services. And that's kind of a branch of Social Security which is housed here at the state level to make determinations on cases. They make the medical determinations on Social Security cases and then give that recommendation to Social Security. Of course, the corrections system, Veterans Affairs. With veterans, many veterans are eligible for Social Security benefits. Even if they are already receiving VA benefits, they are still often eligible for Social Security benefits. So sometimes vets' benefits aren't sufficient. The level that they're receiving isn't sufficient to live on, and that person may then be able to receive the federal Social Security benefit as well. Of course, mental health service providers, vocational services, housing agencies, homeless service providers, any other number of agencies in the community. And another piece of this that I wanted to point out here is the peers. People who are trained as peer support specialists, most of whom work in a community mental health setting, or some of our homeless service providers here in the Detroit area also have quite a few peers that work with their clients in the community. In Michigan, the number of peers who are assisting people with SOAR applications is quite high, and we're really proud of that. Peers do a lot of high-quality work with the clients that they serve, and oftentimes serve a very, integral part in the process of getting SOAR applications approved for their clients. So I did want to highlight them here as well. So, of course, I kind of had to get back to, kind of SOAR's inception. It started in 2005. It didn't start in Michigan until 2008, but since 2005, nationwide, there have been almost 23,000 individuals who are experiencing or at risk of homelessness who've been approved on initial application. And I do want to highlight that initial application because that is kind of a big deal. And overall, the 65% approval rate and an average of 94 days from application, which is amazing. That's about 3 months, of course. So we know most of us in our own practice assisting people that people don't get approved that quickly. And SOAR is a program that sets, we set ourselves apart by having that. And as it says here, it compares to about a 10 to 15% approval rate for people who are not assisted. And then, of course, people who are homeless, is the 10 to 15%, apologies there, and then 29% overall for just a general applicant. So we do find that SOAR approval rates are the highest when the critical components of the SOAR application process are used. And I'm not going to get into all of those because that's something you guys can learn about during training if you choose to do so. But we do find that adhering to the SOAR process is what is kind of the linchpin of getting the best results for cases. So what sets SOAR apart is that case managers actively assist their applicants and they develop the evidence on the case. So they're gathering records on the case for their clients, with their clients, and all of that information then does not have to be gathered by Social Security or Disability Determination Services. All that work is kind of done by the case manager. So it focuses on the initial application, and we want to get it right the first time. So that's something that is really a source of pride for people who do SOAR. And we also aim to avoid appeals whenever we can and focus on documenting the person's disability. We find that successful SOAR communities have steering groups. A lot of times under the continuum of care, or the HARA will also, oftentimes have a steering group or a kind of a subcommittee that meets regularly to address issues and challenges in the local community. We also find that ongoing support for case managers, to enhance communication, quality of applications, supporting people who are doing SOAR applications in the community is really, really important. And we also find that a lot of times our best SOAR applications come from people, or our highest kind of approval rates come from people who are working full-time or part-time solely devoted to the SOAR process because it is quite complicated, and being able to devote that time to the application process we find is quite important. So SOAR applications, of course, maintain the ongoing communication with the applicant, very involved with working with the applicant. They sign on as the person's representative so that they can speak with Social Security and DDS and exchange information. They help with transportation. They accompany the person to appointments. Maybe even consultative exam is ordered after the application is done, so they complete the online applications with the person. And a lot of other detailed paperwork that needs to be completed with the application. They also gather all the documentation oftentimes work with physicians to get things signed. And they provide that timely follow-up after the application goes in so that if there's any issues or anything missing that's needed by Social Security or DDS, they can get that for them. So SOAR training. In order to get SOAR trained, we actually have kind of a new process. A couple of years ago, the SOAR Technical Assistance Center implemented or designed this new process of SOAR training. So it's all online now, and I have the web address listed here to go to the training. It is free and flexible. You can do it at your own pace. It sometimes takes some setting aside some time that's uninterrupted, maybe even doing it at home and taking some flex time. Maybe your employer will let you do that because it is quite lengthy. But the cool thing about the online process is that once you get done, you've actually created your own SOAR application, including the medical summary report. And it does have 16 CEUs for social workers if you complete it successfully. And we do require a follow-up training to this online training, which we call SOAR Fundamentals. So when people finish the online training, we do require that they come to that. That's just about a 6-hour training, so it's not quite an entire day. And we do provide lunch, so we know that we're asking people to do a pretty lengthy training, but we do feel that it's worth it if you do get trained. So a little bit about Michigan SOAR outcomes, and we're almost done here. Since 2008, like I said, SOAR started in Michigan in 2008. We have had over 2,400 applications submitted and an average approval on initial applications of 66%. Our approval on appeals is a little bit higher, and at 76%. Not all SOAR practitioners do appeals, but for those who have done them, they've gotten really good at them. And the average time to approval statewide is about 96 days. So we're about with the national average, and 60% of our applicants were listed as chronically homeless. So I guess to kind of wrap up, the result is that, SOAR is about ending homelessness, promoting recovery, and transforming the lives of the people that we're serving. It does work. It's a win-win for the individual and for the programs that are serving the person in the community. And, obviously SSI, SSDI are major tools in the recovery process for people that we're serving. So I think I've got time, right, Lisa, for some Q&A?
Absolutely, and we have a couple lined up.
Okay, and I'm actually going to switch the screen now and display, I'm currently in this position, but my last day here is next Wednesday. So instead of providing my own information here, I'm providing Wayne Kennerly's information. He works here under me, and he's actually the SOAR liaison and has been doing SOAR technical assistance for several years. So I'm putting his contact information here, as well as our national partner, Kristen Lupfer at Policy Research Associates. She does all of our technical assistance at the federal or the national level. So I listed her information as well. So if there are ever any questions about, hey, what's going on with SOAR in my area? Are there any people doing SOAR in my area, or how do I get connected to that? These two folks are probably the best folks that you're going to want to contact about that. And then, of course, I posted the SOAR training website here, too, as well.
Great. Okay, well, I'll go through these questions one by one, and if anybody has anything else, please type them in while we do that. The first question is, Ella Olive thought that a person had to have a permanent address and not a P.O. box to receive Social Security and SSID?
Actually, what we recommend, and you don't need to have a physical address in order to receive Social Security. I mean, that would preclude any homeless person from receiving Social Security. So you don't need to have a house in order to receive Social Security. But what we do recommend is that when agencies are working with clients, if the person is experiencing homelessness, that they do find some way to allow that person to list the office address so that there is a reliable place to receive mail for that individual. Sometimes shelters and communities will also allow people to list their address in order to receive mail. And even some DHHS offices allow people to list that address for a mail receipt address. So, that shouldn't be an issue.
Great. What exactly homeless services do you provide? Is it just referrals? Asked Michelle LaJoy.
I don't completely understand the question. What a SOAR trainee or presentation does is, I'll just give you kind of like a typical scenario of a person who might be doing SOAR applications. So, let's say a person works at a homeless services agency doing street outreach. That person may have gone through the SOAR training process and received certification to do applications with people that they're serving. So within that agency, they will usually develop their own type of sort of referral process for accepting referrals from other people that they work with in their own agency, and or they will seek out their own customer base, for lack of a better word, via the outreach that they do in the community. So as they encounter people who they feel may be a good candidate and who are interested in having that assistance to apply for Social Security, they would then begin working with that individual and initiate an application with that person. So that's usually how it works. It's oftentimes, if there's a person who does SOAR applications, like let's say at a community mental health, the persons that they serve will oftentimes need to be receiving services at their actual service location, just by virtue of the fact that those are the only people that they're able to serve, if that makes sense.
Now, while they're waiting for their eligibility determination, are any housing supportive services offered to the individual while they wait?
That's up to the individual agency. SOAR is something that is just a way of doing an application. Nothing more. It's not a program. It's not an agency. It's a method of assisting people to apply for Social Security benefits that anybody who would like the training is able to access and learn to become a SOAR representative, if that makes sense.
Okay. So SOAR, it helps with SSI, SSDI, and if you came upon a homeless client, you would get them in contact with an agency to provide services. Is that what you were saying before when we were talking about the services in your scenario?
Yes, and I will say that this is a completely voluntary thing. So let's say that you live in, let's just pull a county from northeast lower Michigan, like Ogama County, for instance. There are several counties throughout the state where there is no SOAR activity, and so that since it is completely voluntary, if there was no one in that community that got trained and who decided they were going to be able to start doing applications, if we receive a call, like if somebody calls Wayne and says, hey, is there anyone doing SOAR in my area that I can kind of refer somebody to, sometimes we actually don't have anyone to refer people to. So that's part of the reason why, being on webinars like this is helpful for us, because we want to spread the word about the fact that SOAR exists and that, people can get trained to assist with these applications, because it can be a very useful tool within the continuums of care across the state to have people who are trained within the COC to do applications, so that there's a system to assess people and assist them with applying for benefits. Because we find in especially less populated areas of the state, there just isn't as much SOAR activity, or maybe not any at all. So that's just one of the challenges. And that's another challenge, the fact that there is really no funding attached to SOAR, but Medicaid can be billed for SOAR activity. So if a case manager or peer support specialist is doing SOAR cases, they can definitely bill for their services, even if retroactively. So once benefits do begin, if that person didn't have Medicaid prior but starts receiving Medicaid, you can back bill for 3 months, of course, for services that have been given. So
great. And the final question that we have relates to finding where SOAR programs are. This one's specifically asking where there is one in the Ann Arbor Ypsilanti area, but in general, how would one find out the closest SOAR program that's available to them?
Like I said before, the contact information here on the screen, Wayne Kennerly is actually the best person to contact here at this state. He, like I said, works right under me. And we maintain the entire database of all of the people who have been SOAR trained, and we also have a list of people who are actively doing applications.
Jose Velasquez asked how you define disability and what it means to be disabled.
Social Security defines disability as a condition that is expected to last for at least, or has lasted for at least 12 months, and or is expected to result in death. Look information up about the definition of disability on the Social Security website.
Well, great. Thank you so much, Tara. If there aren't any other questions about SOAR, then we'll move on from Beth St. John with the Michigan Benefits Access. Welcome, Beth.
Thank you, Lisa. Well, as Lisa just said, my name is Beth St. John, and I am the Michigan Benefits Access Coordinator for the Michigan Association of United Ways. And to give you some background or just kind of a general overview of what the Michigan Benefits Access Program is, I wanted to show you our mission and vision statement. And first I wanted to say that it's so fitting to be here at CDM to talk about Michigan Benefits Access, because CDM was one of the partnering agencies that helped launch the Michigan Benefits Access Program. So we're kind of coming full circle and giving you an update on where Michigan Benefits Access is at now. For the mission and vision, as you can see on the screen, Michigan Benefits Access exists to increase economic stability for Michigan families by connecting them to multiple public benefits through the MyBridges website and also through community partners. So this is a two-prong outreach. They created the MyBridges website to streamline access to benefits for residents of Michigan. And then to support those residents with applying for the benefits, Michigan Benefits Access created a network of community partners across the state, which are health and human service agencies, who have registered with the Michigan Department of Health and Human Services to assist clients with using the MyBridges system to apply for benefits. I'll go into more detail about that registration process as we move on. First, I wanted to go over, in case you're not familiar, just a general overview of what the MyBridges website is and what it allows you to do. It's a secure internet portal offering access to MDHHS benefit applications anytime, anywhere. Directly linked to the Michigan Department of Health and Human Services internal Bridges system for application processing. It was developed and maintained by the Michigan Department of Health and Human Services, and it allows households to create an account to apply for benefits, check their case status, and recertify online. And this is what the MyBridges website looks like, and the URL for the website is at the top. As you can see, it has 3 buttons that allow clients to either apply or view their benefits case, and they do create a user ID and a password that will be theirs forever to log into their information. And just to give you an idea of what benefit programs are available on MyBridges, this lists all of the Michigan Department of Health clients can apply for on MyBridges, which is food assistance, state emergency relief, health care coverage, child development and care, and the Family Independence Program. And you can visit the Michigan Department of Health and Human Services website down at the bottom if you would like more information about any of those programs. And I also wanted to point out that one of the great things about MyBridges is, since it provides access to all of these benefits, it streamlines the application process for clients. They can either apply for health coverage only, or they can apply for the whole bundle of benefits, and it streamlines that application so that it's more convenient for clients, and they can apply for any benefits that will enable them to become self-sufficient. They can apply for them all in one sitting. To give you an overview of community partners and the role that they play, there are two levels of partners who register with the Michigan Department of Health and Human Services. There are access partners and there are navigation partners. And there's also a URL there to learn more about becoming a partner. Both partners agree to promote MBA and MyBridges by displaying promotional materials and providing a computer to be utilized by clients to access MyBridges. And then the main difference between the partners, they are there for clients to come and fill out the application by themselves. So they are an access point to use computers to get on MyBridges, but they are not required to provide that one-on-one assistance. And some examples may be libraries, community centers that have computers available for clients to use MyBridges. Whereas navigation partners, they provide the technical and one-on-one navigation assistance that a client might need to use the MyBridges to apply for benefits. And that assistance might be teaching individuals who may be unable to use the system how to enter their data for the application. And some of the benefits of becoming an access and navigation partner, both of them receive a partner ID number from the Michigan Department of Health and Human Services that will track the number of applications that are submitted from their agency. They just have to enter their partner number each time they assist a client with an application. They'll also get ongoing communication from the Michigan Department of Health and Human Services, such as policy updates or resources that might be helpful for agencies that are assisting clients. MBA promotional materials and signage, and promotion as a navigation partner through the Michigan Department of Human Services and Health and Human Services, and also through Michigan Benefits Access. And I will show you on our website where we have Help Near You tool. Navigation partners also receive, because they're providing that one-on-one assistance, they receive quarterly information on the benefits that their clients have accessed through MyBridges, information about additional training opportunities, and ongoing technical assistance on MBA integration and sustainability. So to give you an idea of the capacity of Michigan Benefits Access across the state, currently there are community partners in every county. There are a total of 48 access partners and 346 navigation partners. And we've trained 6,911 community partners. And we've had 55,942 folks visit our website. And the agencies that have signed on to become community partners represent a wide range of agency types. There's workforce development, human services, community mental health, early childhood services, prisoner reentry, health, senior services, and housing, and that's just to name a few. And we are the Michigan Department of Health and Human Services is continually registering agencies for community partnerships on an ongoing basis. So if you are interested in either learning more about becoming a community partner or completing the application process, let me take you back to this slide that has that URL on it for our Become a Partner page that has more information about becoming a partner and also all of the application materials. And you can also contact me. I have my contact information on the end slide here, and I can also provide you with more information. So I wanted to give you an idea of how the Michigan Association of United Ways and Michigan Department of Health and Human Services supports the agencies that become community partners. There's three main areas. We have our training, access to resources through our website, and also ongoing communication and technical assistance, like I mentioned earlier. For my MBA My Bridges training, it's a 3-hour in-person navigation training. We hold them across the state, both on an ongoing basis. We schedule them, and also agencies can request them, and the request form is on our website. The content includes all of the Michigan Department of Health and Human Services benefits that clients can apply for, how the My Bridges system works, ways that navigation partners can protect clients' privacy and prevent fraud, and also a step-by-step application walkthrough. Recommended participants include frontline staff, such as intake workers, case managers, and volunteers, and they do have to be of navigation partner agencies, so they will have to have completed that registration process to become a navigation partner. All of our upcoming trainings are posted on our MBA website, and we also have an MBA training page that provides you with more information about the training and how you can access the trainings where they are held. We also have many resources and tools for navigation partners on our website, kind of a one-stop shop for MBA information. We post, I try and put updated information on the homepage with posts there. Right here on the right-hand side where it says upcoming events are all of our trainings, and then you can click at the bottom and it says view all events. You can also sign up for MBA news alerts on the website. And we also have, like I mentioned before, we have a way for anyone to find out what agencies in their area are providing benefit access assistance. They can put in their address or zip code and find out the access and navigation partners in their area. And then we have a toolkit that has handouts that you can give to your clients, such as lists of the verification documents they might need to submit to the Michigan Department of Health and Human Services. There's also a client handout where they can write down their user ID and password so that they can remember it. And there's also a View My Case instructions, which gives information on how a client can go back into their case and go back into their account and find the status of their case. There's also assister resources. So those are resources for those who are helping clients, such as some MBA support contacts that they can use, some tips about creating an account, and some navigation tips. And then we also have some promotional materials and flyers there as well. And on our resources page, we have all of the links to the Michigan Department of Health and Human Services resources program there, as well as some additional information about the Healthy Michigan plan and some of the webinars that have been done on the Healthy Michigan plan and some updates on My Bridges. And then we also have the link to 211 there, which is the Health and Human Services phone line that anyone can call to find out about resources in their area. So the link is there. They also have a website, and the link is to the website. And then on the website, we also have our contact information. And as I mentioned, one of the ways that we support partners is ongoing communication and technical assistance. So I always encourage partners to contact me, and I can either try and answer their question or connect them to someone at the Michigan Department of Health and Human Services. I also mentioned that we have an MBA news alert that folks can sign up for. And They can receive MBA updates on a regular basis, and that was right on our home page where you can sign up for MBA news alerts. And we also, on that contact page, we have a comment form where folks can ask questions directly to us. And there's also a blog if someone wanted to post comments there as well. And there's also on the website a For Clients page that gives information about MyBridges, and we also have a general About MyBridges page that gives some more information about the website and what you can do on the website.
Well, that's great. Does anybody have any questions? Linda has a question. Does a person have to have a MyBridges account to post questions, such as if I, as a worker, had a question and I don't have a MyBridges account?
Did you mean post questions on the MBA website? If that's what you mean, you certainly wouldn't have to have a MyBridges account just to post some questions. The website is for anyone to post questions on. You wouldn't need to have a MyBridges account.
It looks like on this contact page that you just fill out a form and it goes to you, and then...
Yep, and then I receive the question, yep, and I'll answer them.
Okay. And
questions on DHS.
So for everybody, she means if you have questions on DHS resources.
Sure. If you had questions about DHS resources, we do have that resources page that has all of the links to the benefits access program. If you wanted information on the Child Development and Care program, this resources page has links to the Child Development and Care program, and she also wondered about how long it takes to get an application approved. There are standards of promptness that the Department of Health and Human Services has for each of the benefit programs, and all of that information can be found on their website. And if you did want to post those types of questions, you certainly can in the comment area that we just showed you on the website, and I would email you directly the answers to your questions.
Okay, so basically on the resources page, programs have a general FAQ overview of the program, but if they have something more specific, they can fill out the form and email you, and they don't have to have an account.
Right.
Okay. Are there any other questions? Okay, well, if there aren't any further questions right now, and you have some later, you are more than welcome to contact me, Beth, or Tara, and the other resources that Tara provided in her absence. I'm sure that anyone would be happy to speak with you more about these things. This concludes another Connect and Share Lunchtime webinar discussing topics that help you help your communities. Thank you, Beth and Tara, for coming today. We hope that you've all enjoyed this webinar. You can access past recordings on the resources page of our website at cdm.info. And if you ever have any questions, ideas for topics, or suggestions for ways for us to connect you with resources, please feel to call me, contact me at any time. My name is Lisa Ostemacher. I'm the Communications and Training Specialist here at CDM. Have a great day.